Hi, I'm Charles Donnelly. I'm a physical therapist. I'm the owner of Regional Rehab Physical Therapy and Laser Center. And today I want to talk briefly about many of my clients come in with neck pain. And a lot of times when people come in with neck pain, the focus of their treatment by their doctors or by the patient or by their personal trainer or maybe even their chiropractor has been the pain right here at the neck, and the whole focal point has been that end of the spine. What I find is the most neglected area of treatment of cervical pain is postural tightness and weakness, particularly at the hip flexors and sometimes involving the hamstrings, but more often than not the hip flexors. Somebody has pain, they are less active, they sit more, they've developed tightness, or they had a tightness which caused them to develop a neck pain, and as a result now they're in for therapy, and the therapeutic treatments that they've been having have not been effective. So what we find is that when I evaluate them for neck posture and movements of the cervical spine, I also do a further testing of the hip flexors. For example, if you saw somebody stand and they can only stand up like this because of tightness or back pain, what's that going to do to their neck? And obviously that creates some stress on the neck and inflammation and chronic pain. So if we can get that person to stand up a little taller, we now put their neck in a more relaxed position at the top of their spine. One of the ways of testing is laying down prone and bringing their heel up to their buttocks. That would be normal range. Oftentimes I see people are limited here and they're compensating. As I start to bend it up, they're trying to do this because it hurts in the thigh. People spend thousands of dollars. You see the ads every night on television about having six-pack abs and developing strength in your abdominal muscles. And here's a low-impact exercise that you can do once a day, preferably in the morning, because most of us, whether you admit it or not, wake up in the morning with aches and pains regardless of our age. And it can be from their sleeping position, or it can be from the activities of 1 or 2 days before that have contributed to some back pain or hip tightness and so forth. The exercise I'm going to show you is very low impact, and it consists of laying down, using as many pillows as you like to be relaxed, bringing one ankle over the knee. We're almost in the start position, but one of the things I want to point out here is that all the work is going to be done right here. And there's 3 positions for each leg to perform this exercise. We'll talk in a minute on how many you do of each one, but you should be totally relaxed from the waist up. This isn't one of those core strengthening exercises where you've got the music going and your neck is strained or you're hurting because just trying to strengthen your core. This is going to be one that's as painless as any exercise I've ever done. So I bring my leg up, and here's the start position, and now I'm just going to contract and relax, contract and relax. Contracting this small muscle group in here, and it's as tight as it can get. If I was to try to go anywhere beyond that, I'm wasting motion. So let's be efficient. Let's focus on strengthening that hip, those abdominal muscles and the hip flexors. So you know, a lot of people have good strength in their quadricep muscle extending the knee, but they ignore the other end of the quadricep muscle, which is the hip flexor. So I'm going to do this contract, relax repeatedly, and if I get tired, I'm going to put my foot down. We'll talk about how many in a minute, but as I bring it up to position number 2, it's all about what direction is the foot pointing. Now from the knee down, it should be nice and relaxed, because again, all the work is being done here. But if I move my foot over here, I'm now going to do the same exercise, but I'm exercising 2 different muscle groups. Instead of the hip flexor and the abdominal flexor, I'm now working the inner thigh and the obliques. And you can actually palpate those muscles contracting. And as I continue the exercise, it's just contract, relax, and this pace is fine. Position number 3, position number 1 was pointed out, position number 2. So position number 3 is internally rotating the hip or bringing the foot out. And I don't have a lot of hip internal rotation. That's just the way I'm made. Some of you will have that foot out there much further. as I continue the same exercise or the same movement, I'm now working the outside of the thigh. I'm working the gluteus medius in here, a hip stabilizer, and I'm working the love handles. And everybody spends a lot of money trying to get rid of those love handles, and this is one of the most effective exercises for that. So as I repeat the frequency, I get tired, I put my foot down. When I'm done with the exercise and I sit up, what do I feel? Notice I'm not up here going after the typical core exercises that we've done so many times or seen on television. Right now I feel a firmness, a gentle tightness here, but I have my breath, I'm totally relaxed, and I also feel that my posture's improved. When I stand up, as a result of repeated tightening and relaxing, this is stronger. And this back here was being gently stretched out during the exercise. So I have a better relaxed low back and hips, and I have a stronger core. So now as I start the walking motion, that motion was similar to the hip flexor, and my theory is you've established a neural pathway. The brain is now telling these core muscles to contract just like they were when you were exercising. I feel you're going to walk around during the day, you're going to have a better posture, you're going to be developing your core muscles more, and at the very least you're going to have a relaxed low back.